Hello there, my name is Dr. Salvatore Meleca. I wanted to essentially construct a video that went over peroneal tendon disorders. And for those of you who don't know what peroneal tendons are, they're essentially tendons that run on the outside of your ankle and kind of behind the ankle bone called your fibula. This is actually the first video that I'm doing. I kind of want to do this as like a regular habit of mine where I leave videos like this to educate patients, and it's really just for your knowledge and for your learning, as well as to kind of answer some probably frequently asked questions about specifically peroneal tendon disorders in this video and many other, foot and ankle ailments and other videos. I read this article called Peroneal Tendon Disorders by Davda et al., which means basically and everybody else. They had a bunch of authors on the article, and I'm actually gonna post the article below in this link. As this video is done, you can go and review it. There's gonna be a lot of medical jargon, so don't get too caught up on that. But essentially what I wanna do is not only summarize this article in a very, very understandable fashion, but I also want to just really educate you as my patient to know kind of a little bit about what might be going on with you if you have a peroneal tendon disorder, okay? There are three types of peroneal tendon disorders. There are splits and tears. There are tendinoses, or like your tendon kind of having some inflammation and degeneration. And then there's also dislocation and subluxation. All of this is going to be evaluated during the physical exam if you decide to come see me, or for any doctor that you go see for foot and ankle pathology. If you do have a peroneal tendon disorder, this is what should be evaluated. They should evaluate you standing. So they want to, check foot alignment to see what kind of a foot shape and ankle shape and rear foot shape that you have. Another thing that should be checked is just pain along the peroneal tendons. Ankle stability should also be checked, and circumduction of the ankle, which means doing circles with your ankle to check if there's any dislocation or subluxation of those specific tendons, which can lead to, split tears and other kinds of disorders of the peroneal tendons, okay? Once all of that is evaluated, a decision will come down to whether we're gonna try conservative treatment or whether conservative treatment might be non-viable in your case. For most cases that are mild to moderate, conservative treatment should always be tried first, because if you can avoid surgery, that's great. Some of these might include, depending on your foot type, non-steroidal anti-inflammatories, orthotics, and among other modalities as well. Definitely want to get weight-bearing x-rays for every single patient. Physical therapy is also another modality that can be used to treat specifically the tendinoses and the split tears, or tenosynovitis, which is just basically inflammation like around the tendon itself while the tendon is not actually degenerating. So those are the three, I would think, mainstay, as I've read throughout the literature, those are the three mainstay or main treatment modalities for conservative treatment before going to surgery. Now, if your symptoms are severe, then obviously conservative treatment might still be of benefit, and it can always be tried, but surgery may very well be more successful in treating your ailment rather than trying conservative treatment, specifically going into any kind of treatment-specific modality. So I'll throw out an example. Let's just say on physical exam, you have a cavovarus foot, which means you have a very high arch, and your heel kind of tilts inward. 80% of people with peroneal tendon disorders have that kind of a foot. So high arch, heel kicks inward, and that's what I see on physical exam when you stand. And then as I evaluate you, you have some pain that comes behind the ankle bone on the outside of your foot, and it kind of carries along that course of the tendon. If you have mild symptoms, for example, and there's pain in that area, but your ankle stability is relatively stable, and you don't have any pain otherwise, or you're not presenting with a history of multiple ankle sprains, and your rear foot is flexible, as I evaluated in my own hands, I can actually correct somewhat your deformity with my own hands, then you would totally be eligible or amenable, if you are amenable to the non-steroidal and anti-inflammatory, the orthotic, and the physical therapy. And that can very well treat your pain. Now, should you need surgery, I highly recommend that you have a very detailed discussion with your provider, because surgery is a big step. It's not necessarily a slam dunk, quote unquote. There definitely are complications to surgery. However, in most cases where symptoms are severe, surgery can have an 80 to 90% success rate, and you can be very well treated, by surgical means. So I highly recommend that you talk to your provider about that in a very detailed fashion. And please, if you have any questions, please let me know. We can definitely get in touch somehow. You can come visit me in my office, and hope to see you soon. Hope that you feel better from however your provider is treating you for the peroneal tendon disorder. And I wish you the best of luck in getting better and getting back on your feet. Take care.